Welcome to Variations 4, the shock unit. And in this video, we'll cover question 14. We're reviewing the head-to-toe map and with a little extra look at blood gases here. And we'll come to blood gases in a minute. Let's look at the map here on shock. And this, again, this is covering all the shocks. This is overall look at shock, the 5 different types. We're not really differentiating between them here, but we'll see some points that are particular to one or the other. So I think a lot of this is intuitive, so I'm not going to speak to each point here. We'll just see which ones come up, which might need a little extra talking here. ABGs we'll talk about in a minute. A lot of this talks to everything we've talked about in this unit already. I think the main thing we need to go through here is the ABGs. So, I mean, most of these points should be pretty, if you've got this whole unit that we've talked about fresh in your mind, then a lot of these will be intuitive. Why GCS? Okay, so it depends why the patient's there. Maybe they had a fall, maybe they had a spinal injury and a head injury, and that's why they're in neurogenic shock, so then you're doing a GCS. That's just one example. Another specific thing here would be like, why are they getting antibiotics? Well, maybe it's septic shock, so they need antibiotics. I mean, there's a lot of particulars here that are for one shock or the other. This is a good one to look at overall. Let's look at, again, I mean, hemoglobin hematocrit. Why might those be up? Well, if it's redistributive shock, then you've lost your fluid portion into the tissues and you're left behind with increased red blood cell concentration. Of course, if it's whole blood loss, like as in something to do with fresh bleeding, then you wouldn't expect any change in those. You just expect a drop in overall blood volume. So I'm just teasing out the particulars here, which you need to do yourself for these points and how they apply. But the one that really needs some explanation here, a little help here with, is the blood gases. And so in your answer key for the in-class questions, you can just kind of read through this. But basically, it's a review of Unit 1 stuff as well as what we've talked about so far in this unit. So you combine those 2 units and you come up with these potential blood gases for the patient in shock. And you're going to have to read through these alone. And just ask me if you have any questions. The answer is pretty clearly written out here. And we'll have to talk about that one-to-one or as a class if you have an issue with what's typed here, because I can't really explain it any more clearly other than just rereading what I've typed here in the first place. So you'll have to read through that by yourself. This is a nice summary for shock here for those blood gases. What do we do? Here's some stuff. So the whole section here is really important for you to read on your own. And then there's a summary here of the goals. All right, and that's question 14 in a nutshell.